Thank you so much, Caitlin and Kate, and hello to everyone in the audience there today. I wish I could be there in person. I wish I could see you, but unfortunately I'm in Brisbane, so I couldn't quite make it down there. So just to introduce myself briefly, my name is Kate Ellis. I'm one of the managers in the education team at the Australian Digital Health Agency, and I'm also a pharmacist by background as well. So it's my pleasure to be here today to talk to you all about electronic prescriptions, including the active script list, what that might mean for you all. If you've used them, if you haven't used them, that's absolutely fine. I'm here to answer any queries that you might have and hopefully kind of clarify a few things for you as well. But before I begin, I would like to acknowledge the traditional custodians of the lands in which we're all meeting on today. For me personally, I'm meeting on the lands of the Turrbal and Yagara people based in Brisbane. So I'd like to pay my respect to them, their elders and past, present and emerging as well. So to have a quick recap of what we're going to be talking about today as the agenda, I'll go through from the very beginning. What is an electronic prescription token? What is it? What does it look like? I'll also be talking about the active script list. Now, this is a newer, I guess, version of the electronic prescription, or the next version of it, and what that actually means and how that might be useful for you. We'll go through a consumer case study. We'll talk about some additional resources that are available if you'd like to know more about electronic prescriptions. And I definitely want to allow some time at the end for question and answers and just to talk about any tips or tricks that you might have in terms of managing electronic prescriptions. So just to kick into it, what are electronic prescriptions? So you'll see on the script there, on the screen there, on the left-hand side, you can actually see a mobile phone with what looks like a QR code on it and a barcode on it, with some basic description of what the medication is for. That essentially is, in a nutshell, what an electronic prescription is. It's a digital form of a paper prescription. So if you choose to receive an electronic prescription from your prescriber, there's a couple of ways in which you can get it. You can either get it via an SMS to your mobile phone or via an email. It's safe, convenient, and it's a very secure option that you can choose for any of your medicines. Now, I do want to focus on the secure aspect of this, because the really clever thing about electronic prescriptions are, you might think, look, oh, that's a QR code. Does that mean that anyone can scan that QR code and have access to my medication or my personal information? That's absolutely not the case. With the specific QR code in electronic prescriptions, only the pharmacy actually has the software to unlock that QR code. If anyone else tries to scan it, it'll come up with nothing. There's actually nothing they can do with it. It's literally only the pharmacies that are approved to dispense electronic prescriptions through their software that are able to unlock that prescription. And the great thing is that there's about 98% of community pharmacies across Australia right now that have the software and are all enabled for electronic prescriptions. One thing I will mention to everyone on the line here today is that you always have the choice. So yes, electronic prescriptions are available, but look, even after today, after hearing about it and all the things you can and can't do, and you think, you know what, I still prefer paper prescriptions. That's just easier for me and my lifestyle. That's absolutely fine. Paper prescriptions are not going anywhere. You're not going to be forced down this path where everything has to be electronic and nothing's going to be paper anymore. I think to put it bluntly, I think even in my lifetime, I don't think I'll ever see a move away from paper prescriptions. There will still be that option there for you. So I just want to provide that reassurance to the people in the room today that choice is always there for you as the consumer. So how do I get an electronic prescription? So if your prescriber says to you, or you say to them, I would really like to get an electronic prescription, what are the ways in which you actually receive it? Well, the first way is to get an SMS to your mobile number, so you get a text message, or you can actually choose, if you've got a carer or a trusted family member, you can actually choose for them to receive that prescription on your behalf. That's absolutely fine too, as long as you've given permission. The other option is you can get it sent to your email address. Likewise, if you'd prefer it sent to a friend, a carer, or a trusted family member, you can absolutely nominate their email address instead with their permission, and that can be sent to them as well. Or you can get it printed on a piece of paper as well. So this slide here basically gives you a little bit of a snapshot. If you haven't received an electronic prescription before, this is what it looks like. So you might have your mobile device in front of you and you'll get a text message that says something along the lines of your prescription. You'll click on that text message, it'll open it up, and you'll see basically a little screen there that says tap to view your electronic script. Now, we'll preface this to say that to open up an electronic prescription with a token, you will need to have access to the internet, because that is the way in which electronic prescriptions work. So whether that's connecting to a Wi-Fi or connecting to a 4G or a 5G, that is how you'll open up that electronic prescription, because it does need to kind of download that information. And once you've tapped that, then it actually comes up with the prescription itself. And as you can see, it really looks like a QR code, essentially. It's got information about the medicine, the date, how many supplies are remaining. And it does actually, I think it's cut off the top there, but it does have the initials of the person that the prescription is for, but it does not include your full name. It doesn't include your address. It doesn't include your date of birth. Any of those personal details are actually locked down and held within the QR code that, again, as I mentioned, only the pharmacy can unlock. So it gives you that peace of mind that even, heaven forbid, you get your phone stolen, or someone gets their hands on it and it's got your electronic prescription on it, and you think they're going to steal that information or they're going to know all of my personal details. Absolutely not. Even if they click on that, it's actually not going to give them too much information. It's really going to tell them the name of the medicine and some initials and a date. But the full data is actually encrypted in that code that only the pharmacy is able to open up. This just gives you a little picture of what an electronic prescription may look like on an email. So if you received it by email, very similar. You'll get a message to say you've received a new email. It says electronic prescription, and you click on the link and that will open up the electronic prescription. The great thing about emails, and also SMSs as well, is they can be forwarded. So I personally have received an electronic prescription when I had COVID, and of course I was in isolation at the time. So to receive my medication during that period, I had a telehealth appointment with my doctor. I received my electronic prescription via email. I then forwarded that email to my local pharmacy. The pharmacy opened it up. They scanned the prescription. They dispensed the medication for me, and then they delivered it to my home. So it was absolutely incredible that's even a thing that we can do now, but it really gives you a bit of an idea of how far we've come over the last couple of years with COVID and the development of electronic prescriptions, how it can be quite convenient for those times in need. So what do I do? Once I've got the electronic prescription code, the QR code, what do I do with it? So you take it to your preferred pharmacy. I mentioned 98% of pharmacies across the country are able to use electronic prescriptions. So chances are your local pharmacy will absolutely be able to scan the token for you. As I mentioned, you can forward the token. So this is sometimes what people do. They can forward the token. When I say token, I mean electronic prescription token to the pharmacy by SMS or email, as long as the pharmacy is alerted to the fact. So what I would always say is give the pharmacy a call or give them a heads up and let them know, look, I've just forwarded you an electronic prescription. Can you please fill that for me? I'm going to pick it up, in a couple of hours, or my daughter's going to pick it up later this afternoon. Then they know, okay, I need to find that email. I need to do that for this particular person, and I need to have it ready by this afternoon. And then that way, when you get to the pharmacy, you're not having to wait in line. You're not going to have to, go away and find things and come back. It actually is a bit of a time saver. So that's what I like about it too. Or there are some pharmacies that actually have apps, and you can order your preferred medicine from the app as well. So there's a number of them. A lot of the bigger pharmacy chains have their own app, which I won't go into today, but that is another option. What I'd recommend is just speak to your local pharmacist and they'll point you in the right direction of the best thing for you. And that's basically how it works. It's actually, relatively simple. In terms of prescription repeats, so say if you have a regular medicine for a heart condition that you're on, and you always get 5 repeats with every script that you get, what I've got on the screen there is what traditionally it looks like. You get that yellow piece of paper that's stapled to the top of the script, and that's treated as your repeat. For electronic prescription tokens, it works a little bit differently. So you can see on the right-hand side of the screen there, I've got a picture of the QR code token, and you can see on the left, it says 2 supplies remaining, and then the one on the right says 1 supply remaining. So what happens when you get a repeat prescription, the first token that you sent to the pharmacy actually gets unlocked, dispensed, and then it basically becomes redundant. You cannot use that QR code token again because you've already used it. Then when they send you the repeat, they actually send you a brand new token. So you actually get another SMS or another email with that token on the right-hand side that says one supply remaining. So then you know this is the one that I need to use. Because if you try to use the previous one, the one that says 2 supplies remaining, you'll try to open it up and it will just say, you know, it won't work. This prescription has already been filled. And that tells you, okay, I need to find the new token in my SMS history or my email history that says 1 supply remaining. That's the one you need. Just as a little tidbit, I know certainly it can, for those of you on the line who may get electronic prescriptions and you're thinking, I get so many messages or so many emails, it's hard to find the one that I need. I think I accidentally lost it or I don't know where it went. Maybe I accidentally deleted it. If that happens, if it's an original prescription, the very first time you've got the token, you've never used it, you can call your prescriber, your doctor, and they can reissue the token for you. They should be able to do that straight away. Just give them a call. Or if it's the pharmacy and you know it's the repeat and you don't know where the repeat went or you've accidentally deleted it, if you ask the pharmacy, they can actually resend that SMS or email to your repeat again. So this is another great thing about electronic prescriptions, because I guess if it's a piece of paper and you lost it, or perhaps you spilt coffee all over it and you couldn't read it anymore, basically there was nothing much you could do about it because it's a piece of paper. Once it's gone, it's gone. The great thing about electronic prescriptions is once it's gone, sometimes you can actually get it back again, which is kind of cool. So I have gone through a couple of the benefits already. It is convenient. You don't need to carry around a paper prescription for you. It can be super easy in terms of, you know, if you say your partner's coming home from work or your children are picking you up or visiting you and you say, oh, look, can you just pick this up on the way home? You can forward the script to them and they can pick it up on your behalf. So as long as they've got your permission to do so, that's something you can do. So there is that convenience factor. Wherever you have internet access, basically, because you do need to be able to open up that script. Another option is you can screenshot the electronic prescription token while you do have the script open. So what I mean by that is, say if you go to a shopping center and you know notoriously that shopping center has bad reception, the pharmacy's in there, your Wi-Fi never works or your 4G never works. What I'd recommend is open up your electronic prescription before you go in, take a picture of it, take a screenshot of it on your phone, and then you can walk in with the screenshot. And as long as the pharmacy can scan the QR code, as long as they can see the QR code, that's actually all they need. So that can help to resolve those issues. It's super useful if you have telehealth appointments. I mean, it was almost essential during COVID. That's actually when it all got fast tracked. When we all went into lockdown in March of 2020, it was only 6 weeks later that the very first electronic prescription was ever issued in Australia. And I think off the top of my head, I think that was the 10th of May. So within a period of 6 weeks, there was basically, we realized we really there's a need for this, for consumers to still have access to their scripts during the time of COVID. So absolutely. And you can still use it for telehealth appointments now. And you can use it for non-telehealth appointments. You can really use it for any appointment as long as your doctor can give you one. Can save time. And the other thing I wanted to say is, if you're on a number of medications, or say you do find managing multiple SMSs or multiple emails and there's a few different scripts and it does get a little bit confusing, especially if you do take a number of medicines, the next option for you is the active script list. And that's what I'm going to talk about next, because this is a bit of a newer version of electronic prescription. It still uses the same, I guess, principles and technologies, but it actually does make it a little bit easier on the consumer end. So this is what I'm referring to as the active script list, or ASL for short. Essentially, it's still electronic prescriptions, but instead of having to receive that individual SMS or email every time you get an prescription, it actually can go, I guess, in the cloud, what we call the prescription delivery service, but it's basically like a secure cloud directly from the prescriber to the pharmacy. So rather than having you as the middle person, you know, having the token on your phone, having to find it, having to forward it on, it actually almost misses that middle step and goes straight to the pharmacy, and then they can actually download it from that prescription delivery service. So they're all still your prescriptions, they're all still valid, but it just kind of misses a little bit of that step, and they can access it without having to scan the token. They can just access it as if they open your patient file and it's there. So that can be a more convenient option for some people, especially people that keep scripts on file. I know that there are some people in my pharmacy that always have all of their repeats on file. They always came to my pharmacy. I knew off the top of my head what medicines they were on. If that's you, or if that's something that you'd like to talk about, I'd probably speak to your local pharmacist, and they could probably recommend if it's the right option for you. So how does it work? So the main thing about Active Script List for consumers is the permission side of things. So if you're interested in this part of electronic prescriptions, go to your preferred pharmacy, go to your local pharmacist and ask about it. Ask about, well, I've heard about the Active Script List. What is it? Do you think it's the right choice for me? Should I be registered? Basically, the pharmacist will ask you a few identifying questions. They might need you to show your Medicare card or your ID. Once they've verified you are who you say you are, they can sign you up for the Active Script List. And it does require you to reply on a text message or on an email to say, yes, I give my permission. And so that's all in writing, and that agreement is in place. Then the next time you go to your doctor and need a script, basically the doctor will add it to your Active Script List. And then that way it basically goes straight away into the cloud, and then the pharmacy can access it on their end. It really does mean that any electronic prescription that you have from that point onwards, and anything with a little barcode on the bottom of a paper script, will go up. But if you choose, say if you want most of your things to go up, but there are a couple of medicines that you are a little bit sensitive about, you don't want everything to go up there, you just want to pick and choose, that's fine too. Just let your doctor know and they can make sure it is or isn't added to the Active Script List. As I mentioned, then once you're on there, you go to your pharmacy, they validate your identity, and then they can issue you with your prescription repeats. That goes back on the Active Script List, and they can give you a medicine. So what I'm going to do now is I'm going to actually show you a little video which describes that process, hopefully a bit more clearly.
When you visit your doctor for a prescription, you can choose an electronic prescription for your medicines. An Active Script List is a digital list of all your electronic prescriptions and is helpful for people who are taking multiple medicines. When you have an Active Script List, you no longer need to keep track of each electronic prescription token from your doctor or pharmacy. You will also not need to worry about losing your electronic prescription tokens. It can assist your doctor and pharmacist to help you to manage your medicines more easily. You can register for an Active Script List by speaking with your pharmacist. You will need a mobile phone for registration, and you may be asked to provide documents to prove your identity. You can also nominate a carer or family member to help you look after your Active Script List and collect your medicines. Once you are registered, any electronic prescriptions that you receive will be automatically added to your Active Script List. However, you can choose for some medicines to not be added by speaking with your doctor. When you visit a pharmacy, let them know that you have an Active Script List. Each new pharmacy will ask for permission to access your list. You can control which pharmacy has access by responding to an SMS or email. The pharmacy will then supply your medicine without you needing to show a copy of your electronic prescription token. To register, speak to your pharmacist. For more information, visit digitalhealth.gov.au/electronic prescriptions.
Okay, I'm back. Hopefully that video worked for everyone and you could hear it okay, and hopefully you can hear me again too. Please let me know, Caitlin and Kate, if you can't. Otherwise,
thank you.
Thank you. Always good to check that technology is working in the background. So hopefully that gave you a little bit more of a picture of what the Active Script List was and how it works. As I mentioned, really helpful for patients that may use script on file, or if you're a regular customer at the same pharmacy, it could be an option there. Someone who takes a lot of medicines may find it more useful, so they don't have to navigate or look at multiple text messages or emails at the same time. And as I mentioned, if you do find that you are losing your tokens or accidentally deleting them, or you're not sure how to find them, sometimes it can be easier for those people to have an active script list. So to just quickly go through a bit of a case study of what this actually looks like in real life, how will this work if you're going to be using a prescription, perhaps you're traveling, how does that work across the country? So we've got our patient here, Tracy. So Tracy takes multiple medicines. She has a few electronic prescription tokens, and she still has one paper prescription left. She likes to use tokens, but sometimes she does have a little bit of trouble finding them, or she gets confused between which token is what. So she's decided to go to her regular pharmacist, and the pharmacist said to her, look, I actually do think the active script list would be a good choice for you. So she's signed up, she accepts the terms and conditions, and she wants all of her current electronic prescriptions to be included. Basically, the pharmacist uses that to provide her medicines and pretty much gives her ongoing access. And that's ongoing access for electronic prescriptions. I will note, though, that there are some prescribers across the country that they still handwrite prescriptions. They don't even use computer scripts at all. So keeping in mind that it will only refer to electronic prescriptions, but you may still receive handwritten scripts from some doctors. That's just, I guess, the reality of the situation at the moment. However, Tracy's actually away on holidays and she needs her repeats filled. So she's not in her normal pharmacy. She's gone away on holidays somewhere else. She's got one paper prescription repeat, but the rest are in her active script list. So she's thinking, okay, well, what do I do now? So she's gone to a new pharmacy in that local town that she's visiting and asks if they can access her active script list. The great thing is that pharmacy can, because the percentage of pharmacies across the country that can access electronic prescriptions as a whole is 98%. Those that can access active script list is about 85%. So majority of them can. But the good thing about this is Tracy has said, well, look, I'm only a tourist in the town. I'm only going to visit this pharmacy once. I don't want that pharmacy to have access to all of my scripts for the end of time. That's absolutely fine. She can actually elect for that pharmacy to have access to her scripts for one day only, just to get that supply while she's away on holidays. And then once that day is up, then they can no longer access her script. So that's absolutely an option for consumers as well, to give you that peace of mind. So in terms of additional resources, I will show up on the screen there. There's a QR code for our learning modules. We actually have specific e-learning modules on electronic prescriptions if you want to know more about electronic scripts. And it also, as part of that module, includes videos on how to use electronic prescriptions. It also goes through a number of tips and tricks. A few of them I have kind of mentioned to you today already, but it goes through it in a lot more depth. So please feel free to scan the QR code. It may even be on the little survey forms that you have in front of you on a piece of paper. That's another option too. Or otherwise, I'd recommend talking to your local general practice or your preferred pharmacy. Pharmacies are very au fait with electronic prescriptions these days. They're probably the best place to talk to, and they can kind of weigh up the pros and cons and what's going to work best for you, especially if they're your regular pharmacy. They should know you fairly well and what's going to work best in your situation. So on that note, I will open it up for question and answers in case there's anyone in the audience that had questions for me or would like me to go in a bit more detail about anything I've spoken about today.
Okay, thank you very much, Kate. So just to let you know, we will send the links and the QR codes around afterwards, and there is an evaluation form that we'll also give you, and we won't let you leave until you've done it. Yes, exactly. So because of our strange technology setup, if you would like to ask a question, I'm going to give you a microphone and we will hope that Kate can hear you. Who wants to go first?
Sorry. This one? There we go. My question is there a way for us to find out if we already have an active script list? My pharmacist, when I went and talked to them, found that I already had one, but I'd never received any text or information. And apparently there'd been one there for quite some time.
Oh, that's very unusual because when you very first sign up to an active script list, the only way a pharmacy can see it is they actually have to send you an SMS or an email to your phone right in front of you, and you have to press, yes, I give permission to be able to do that. That's the way that an active script list is generated. It's interesting that they say to you that you've got one even though you don't recall doing that. That's unusual. What I can do is there is a contact person that I can and get you in contact with for your unique situation, if you like, and they should be able to have a look at the active script list and see whether you do indeed have one. The pharmacy should be able to tell you that, but if you're not sure about the pharmacy, I'm happy to send you those contact details.
That would be great. It's more just generally, if people aren't sure, is there a way to check?
So I guess more generally, at the moment, pharmacies that are registered with the system are the only ones that can access the active script list. At the moment, consumers or patients aren't able to access it on their phone or their device themselves. However, that is going to be changing soon. So we're actually implementing, I guess, advances again. So we're trying to improve electronic prescriptions time and time again so that consumers can actually access the list on their local device as well as the pharmacy. We've just got to get the permissions in place. It actually does get quite technical and complicated in terms of privacy, but that is actually something we're working towards. So at the moment, there's probably not a super easy answer to that question, a super easy way for you to have access to it yourself, but that is something that we are actually doing or implementing in the coming months.
Thank you.
Thanks.
First, sorry, so yes. I just wondered if there's any work happening. Thanks for that too, Kate, by the way. But I just wondered if there's any work happening in, because I understand the dilemma you talked about with people on multiple medications having lots of codes, to go through. Has there been any work happening to have a system that once a script has filled, once that token has been read and the script's been filled, that it can then be deleted from your phone so that you don't, you don't have this whole collection in your phone that you've got to try and get rid of?
It's a really good comment and a good question. I'm just going to bring up on screen now. This is an additional slide. So what you see now is basically what will happen if you try to open that token and you've already dispensed it. So say it'll basically be the phone that's in the middle. You'll try to open up the QR code and it'll say, this prescription has already been dispensed. So what I recommend, based on your comment, if you're on multiple medicines, it does get confusing. What I always say to people is, once you've actually had that token dispensed, you've got it dispensed, that repeat has already come to you, or maybe if there's no repeats left, that's it, I would delete it. So I would actually delete the email or I would delete the SMS. At the moment, it is a manual process because I guess the consumer is in control of that information. So some people like to keep them so they can kind of keep track of them. Me personally, I recommend to delete them because I think once you've got it, you've got the medicine in your hand, you don't need it anymore. If you're going to open it up, it's going to say this anyway. It's going to say this prescription's already been dispensed. It's not really any good to you. I would delete it. That's the cleanest way to do it. And what I do recommend as well is, and it depends on how you prefer to manage your electronic device. I personally, if I'm going to get an electronic prescription, I actually find emails are easier to manage than SMSs. Emails I find are easier to manage because they have a better search function. And in emails, you can actually flag emails. You can put a little folder. So every time you get an electronic prescription, you can put it in a little subfolder so that all the scripts are all together. Whereas SMSs, yes, you can flag or you can tag them so they might appear at the top list of your SMSs, but you're very limited in your ability to put them in folders or segregate them. So also I guess it's personal preference too, but that would be my advice in that situation.
Thank you, Kate. My question is, I'm Beatrice. My question is in relation to security and safety. Say, for instance, your phone, you've set up all your ASLs and everything's all set to go. You've given the chemist has got your ID and all that sort of stuff. But say you lose your phone or someone steals your phone and they happen to be someone that likes some of the drugs, you know, that you have a bit compromised for other people, you know. What's the security? How is it that, you know, can you guarantee that our scripts are safe?
Yeah, really good question. And this is actually something that electronic prescriptions, and I personally believe they're more safe than paper prescriptions in the way that the QR code. So let me bring up another picture of it. So when you look at the QR code, so this is basically what's on the screen there. That's what you see. So if someone stole your phone, this is all they'll see. They'll see some initials, they'll see whatever the medicine is, the date, how many supplies are remaining, and they'll have a QR code. There's actually nothing they can do with that. They can't scan the QR code themselves. They can't access the medication themselves. This picture that I've shown you here, that's not a legal form of the prescription. The legal form can only be unlocked by the pharmacy on their end. So that person, say they stole your phone, came into the pharmacy and tried to scan that script, even if the pharmacy took that, scanned that QR code, and it said, my name is Kate Ellis, age what have you, and pharmacies, as part of their due diligence, it's a legal requirement, they need to know the person that is filling the script is who they say they are. And if they're not sure, they need to ask for verifying information. So if they know, I know you don't look like Kate Ellis. Kate Ellis doesn't have any friends or family members that collect on her behalf. Kate Ellis doesn't have any carers. Who are you and why have you got that prescription? They will refuse supply and they won't dispense it. And if that pharmacy, if that person decides to go to another pharmacy, they'll have the same problem. And as I mentioned, the QR code, they can't do anything with that. Only the pharmacy is able to unlock it and actually give permission to supply the medicine. And if the pharmacy isn't able to confirm you are who you say you are, they won't supply. They'll refuse. And there's actually mechanisms in place for them to, I guess, lock scripts, so to speak, so it can't be accessed. If they do believe it's fraudulent, there are mechanisms in place. Hopefully that helps to answer that question.
Thank you, Kate. Great presentation. I'm Emma. I have used electronic scripts. Once you've taken them into the pharmacy and they've scanned them, is it safe then to delete them from your phone because they've got it forever?
Yes. So what I would recommend there is, I'll go back to that screen I shared before. I'll go to the one with the repeats on it. So once you have gone into the pharmacy, they've scanned your QR code. So say, for example, they've scanned this one here for amlodipine and it says 2 supplies remaining. You've got the amlodipine in your hand. You've received the prescription. You've got the medicine. You know it's there. At that point, and you know, say there was a repeat remaining and you've received that SMS or email. So you've not only got the medicine, but you've got the repeat token for the next supply that says now 1 supply remaining, then you are safe to delete this first one here because there's no need for it anymore. Anytime you try to use it, it's going to say that it's already been used. And so it's really, there's no really point in having it. So what I recommend is as long as you've got the medicine in your hand and if there are any repeats, you've got a copy of the repeat token, then you're safe to delete the first one. Another thing that some pharmacies do is they're all different in the way they help manage it with their customers. Some pharmacies scan that first token in and they have a way of kind of keeping the scripts on file their own way. So if that's an arrangement you have with that pharmacy and they are able to keep the repeats on file the way that they manage it, that's also fine as well. It just is a matter of confirming it with them.
Just a couple of questions.
Sure.
One, is there any medication that can't be put on an electronic prescription? And yeah, and my other question is, if you change phones or change your phone number, what happens then? Do you just have to go back to the pharmacy and so what's the process? I guess I'm asking.
Great questions. So first question, basically every medicine can be prescribed by electronic prescriptions. So that includes your normal medicines, PBS medicines, private medicines, Schedule 8 or controlled drug medicine. So strong painkillers, narcotics, all of those, they can all be prescribed with electronic prescriptions. There are a couple of specific types that cannot. Sometimes very, very high cost medicines, or say if you have a specific regime and the doctor always needs to ask for special access and they have to apply to Canberra and get it all approved with Services Australia. It's a bit of a process. Sometimes they have a big red stamp on the paper script. Any of those very official or very high cost medicines, they still are paper because they require specific approval from Services Australia in Canberra. But anything else, basically, yes, you can use electronic prescription. So by far the majority of prescriptions can be electronically. It's really just a matter of the prescriber having the software to be able to do it, which most of them do. Most GPs across the country, if not all GPs across the country, should. Some specialists don't, because there are some specialists, honestly, some specialists are still paper-based. They still actually handwrite scripts. They don't even use a computer for scripts. So in those circumstances, they can't give you one. But if the technology is there and if they use a computer, they should be able to. To answer your second question, if you change your phone number, that is a really good point and very important. So if you change your phone number or if you change your email address and you know that you regularly get electronic prescriptions, please tell your prescriber or please tell your pharmacy your new contact details, because otherwise, whatever the details they have in their system is where the repeats and the scripts are going to go. So this is something I always say to patients using electronic prescriptions. If you're sitting in front of your doctor or you're on a telehealth call with your doctor and they say, I'm going to issue an electronic prescription, do not end the call, do not leave the consult room until you can see it on your phone and say, yes, I received that script. Yes, I've got it right in front of my face. Likewise at the pharmacy, do not leave the pharmacy until you confirm, I'm comfortable. Yes, I've got the repeat here in front of me. They should always be confirming your contact details with you anyway, but I would be preempting that by saying I have a new phone number. Please make sure it's in the system.
Thanks, Kate. Any other questions? Okay, 2 more. Have you got time?
Yeah, no worries.
Let us know if you need to go.
No, that's okay. No problem.
Hi, thanks, Kate. My name is Jing. My question is around ASL, like how much control of consumers to decide when to dispense the prescriptions. For example, if I'm seeing the GP today and they prescribe something, and this goes straight away to the pharmacies, but on the same day, I change my mind. I want to pick up my medications maybe 1 month later, or I don't want to be using this medication anymore. So what is a way of communication? I just need to call the pharmacies? Will that overload pharmacies in this case?
So with the I guess mechanism for active script list, they basically go up from the prescribing system to the pharmacy system in the cloud, secure prescription delivery service, and they just sit there under your name. But it's not as if the pharmacy doesn't get notified to say, Kate Ellis has a new script, or Kate Ellis has 10 new scripts from the doctor, you need to dispense all of them. That's actually not what happens. It will only be opened up and activated once I, Kate Ellis, walk into my pharmacy and say, I've received a new script. It should be on my active script list. Can you please dispense X, Y, Z for me? Don't want you to dispense anything else, just those ones. And they're the ones that they'll dispense. There shouldn't be any pharmacy that will ever automatically start dispensing things if you're not even in the pharmacy. That's absolutely not the case. If if you have things on your active script list or an electronic prescription token, it should be the patient communicating with the pharmacy to say, I want this dispensed or I don't want this dispensed, and that signals it to them. Otherwise, they will just leave it there. It'll just sit there until you're ready. So I guess it gives you that peace of mind that just because your doctor's prescribed 5 new medicines, but you only want to get 3 of them, the pharmacy is not going to have all 5 ready to go for you. They'll only start dispensing them if you tell them. So whether you call them or you email them or you go there in person, they need to verify that with you before they dispense anything. Hopefully that helps.
Kate, my name's Catherine. Thanks for your presentation.
Catherine.
I was just wondering if you could talk about, so for me, I've got a couple of kids and they have prescriptions too. Is active script list the best way to sort of manage the variety of people's prescriptions that I'm trying to manage, or you know, how's best to do that when you're looking after a number of people's prescriptions?
That's a really good question. And as a mother of myself and thinking about the scripts and bits and pieces I manage for my one child, multiple is another thing entirely. So in my honest opinion, right now for yourself or for someone in that situation, I'm a bit of a control freak. I like to be able to see the prescriptions myself, and I like to be able to manage the tokens. I personally would manage it myself. So I would request that my prescriptions are sent by electronic prescription via email, and I would create a folder in my email, one for myself, one for my husband, one for my daughter, and that's how I would manage all of my different prescriptions. Active script list is a really good concept for managing multiple medicines, but it does get complicated if you are the carer or primary caregiver for multiple people, because you can't actually, at the moment anyway, this will change in the future, but at the moment, you as the consumer can't see them all, and you can't see yours. You can't access them all yourself and try to figure out, okay, how many repeats left for this one, and my son got this and my daughter got that. So if you're wanting to manage it in that respect, I would actually recommend just normal electronic prescriptions tokens for you. And I would probably categorize them in email folders, or somehow flag them in your SMSs instead. In the future, active script list will be amazing. But I think if you're managing multiple people, that's a future state where you'll be able to see all of that and then manage it that way. I think active script list is probably more ideal for people that are managing multiple medications for themselves or just one person, so they can kind of keep a track of them. Hopefully that makes sense. Hope I helped to answer that question for you, or provide some clarity.
Thank you, Kate. Any more questions? All right. Well, I think we might let you off the hook then, Kate. Thank you so much for spending time with us today. We really appreciate having that information that can help us learn how to manage our medicines a bit more.
No worries at all. It was a pleasure to be here. Thanks, Kate and Caitlin, and thank you so much, everyone. And really open to any feedback that you're able to provide on those feedback forms. And pleasure to be here today.